Hello all, I am Nischit. Today we have Dr. Vasudha M. Sharma, our Senior Doctor, Medical Director of Vivekananda Health Global with us. She is an international speaker. She has been practicing in the field of Ayurveda and Yoga since 2 decades. Without much ado, I welcome Dr. Vasudha M. Sharma. Welcome, madam.
Thank you.
So today I have few questions in my mind. I believe I represent a common man thinking of how yoga and Ayurveda can be combined to get or to be utilized in a better way. So I'll ask few of the questions which I have marked. So first of all, how Ayurveda and yoga are connected, ma'am?
See, Ayurveda and Yoga are definitely known to be ancient traditional systems, as all of us know about it. So, Ayurveda has got an in-depth understanding of lot of physical requirements of the body, and Yoga has got an in-depth understanding of lot of mental well-being, what a human being wants. It doesn't mean that Yoga doesn't talk about physical requirements, and either side Ayurveda does not. But the way they come together is very interesting, and I think it's the best thing which has happened for the people who are looking towards restoring their health especially. So Ayurveda say brings in the physical component. For example, we talk about Ayurveda remedies or Ayurveda medicines, we talk about external Ayurveda treatments, and a lot of mental components which yoga talk about, which are based on what are known as sattva, rajas and tamas, which are the mental traits. That is what yoga actually focuses on. So how do you balance your yourself, especially mentally, and how do you balance yourself, which is physically, using say the dosha principle or the tridosha principle of vata, pitta, kapha, is how we can very nicely bring them together. We know that there is a very deep understanding between how a dosha is related to the sattva, rajas, tamas component. So if you say vata dosha, for example, then you know that a person with vata prakriti might have a combination of sattva and rajas. Likewise, you will have for the other doshas as well. So this is one way of understanding how they are interconnected, but large picture is that we know that they are complementing each other by bringing in the best of what they are known for, the physical well-being and the mental well-being.
So beautifully explained how yoga principles and the Ayurveda principles combine and how each of them complement each other. Thank you, ma'am. Moving on to the second question. Ma'am, how does Ayurveda incorporate yoga as a part of its holistic approach to its health and well-being?
See, yoga has got a larger dimension of giving us better psychological health. So when we talk about incorporating, it's more of bringing that mental well-being component, which is a very essential part of being physically well. Now suppose we look at people around us, right? So when you look at it, we know that people feel very stressed. Physically they may not be having any problem, but they are otherwise mentally very stressed. In this scenario, he or she will be facing maybe a neck pain regularly, a lot of stiffness in the neck. At this point of time, if her stress is not put under control, then he or she will not recover from the pain. So now you are able to understand how you need to bridge this gap by bringing in the psychological well-being component, which is highly essential in the form of say stress management, but also treat this person for neck pain. But your whole treatment is not going to be effective, or you are not going to get the result and see that the person is going to be free from pain unless you incorporate the best of yoga, which is reducing the stress.
Nice, ma'am. Good to know all these information. Ma'am, when it comes to yoga, what role yoga plays in promoting physical, mental, and emotional balance?
See, yoga has largely approached this concept of well-being. So there is the concept of Panchakosha, which is drawn from the Taittiriya Upanishad, and that very nicely has 5 layers in the body. If you also see, say, the 5 layers like the petals, like of a lotus, similar style. So you talk about the Annamaya Kosha, the Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha and Anandamaya Kosha. There are 5 layers which the Upanishad very clearly explains what this denotes. So when you say Annamaya Kosha, Anna is food, right? Annamaya is that which revolves around food. So what is man made up of? Food. Basically, we say that you need to eat to live, but it is a lot more than that definitely. But this is basic what we understand. So Annamaya Kosha consists of the physical requirements of the body. So when we talk about yoga, we talk about okay, what practices can we give to see that the Annamaya Kosha, the physical health is taken care of. Likewise, you have the Manomaya Kosha, so you're talking about emotional well-being there. Your mind has to be happy. So there are a lot of techniques, different yoga practices which work at mental well-being. And then when you talk about better pranamaya kosha balance, you talk about breathing, pranayama, and they are going to rightly influence how your different organs work. Because see, breath is a single factor which is very essential for us to stay very healthy. If you see an individual who has say a problem, okay, for example, let's say asthma, okay, Bangalore we see a lot of these people with allergies. You'll see that they're usually breathing a little faster. So the breath rate is a little faster. How yoga can help them? One, of course, while doing regular yoga, their respiratory indices become better. Their patency, that is, the tubes reaching your lungs will expand better, so that naturally your oxygenation is better. But as the breath is controlled and as the breath is modulated, or people are taught to rightly breathe, you will be surprised to know that people breathe wrongly. So when we take regular yoga classes, we do this, they may be doing the other way around. Okay, so the abdominal movement ideally should be when you breathe in, your abdomen will go in. When you breathe out, it will relax. They might be doing the other way around. So therefore, rightly practicing yoga the way it is supposed to, and not probably popularize yoga is very, very important here, because we are not talking about some different cults which are associated with yoga, and not like hot yoga, cold yoga and different yoga, but we are talking about traditional yoga.
Nice, ma'am. So definitely a good takeaway here, because people should learn how to breathe, because that's the main thing which controls. I believe this is related to pranayama.
Yes.
Yeah. So people should learn those. Yeah, definitely I would.
If not pranayama, at least people should relax by just doing deep breathing. You're in your office, you're working maybe 8 hours, 9 hours, or even more. So maybe during lunch time, or at least after 2-3 hours, if you're stressed, just sit on your chair, take few deep breaths. You don't have to do much, and people will not even know what you're trying to do. So it probably takes half a minute to do a couple of them, but you will see the change in yourself when you do it regularly.
Nice, man. Definitely, I would try to do this. Not try, I would definitely do this. Moving on to the next question, ma'am. Combining Ayurveda and yoga, like I have a question here. So, what are the specific benefits of combining Ayurvedic herbal remedies with regular yoga practice?
Okay. See, it's a very important question, because people feel that okay, when I take medicine, I'll be healed. It's not like that. First of all, you should have faith in whatever you're taking. You should have a lot of confidence in the doctor, and you also should know that okay, your body is ready to accept. If you try and say okay, let me try, let me go, dekhte hain, this doesn't work. Okay, because why it doesn't work completely is because you are setting a barrier there to your mental components. So when your mind and body are in sync, you obviously feel healthy. Likewise, when your the medicines you take have to act better, your mind has also to be playing a very crucial role there.
In sync.
Yes, in sync. And if not, then you will not achieve what you want. So the doctor also has to understand, and the patient also has to understand. So therefore, it's very important to streamline your thoughts, to say and feel that yes, I'm going to take this and I'm going to be well. Let me try, let me see, let me check. If you try to do shopping, then it cannot help.
Good to know. Ma'am, just a follow-up question. What are the dietary recommendations in Ayurveda?
See, the dietary recommendations in Ayurveda fall under the concept of what is known as pathya. How pathya is defined is a route you take when the medicine has to reach your body and do the best for you. Then you also have to aid it with proper food. Now it is like, okay, I have been given 3 medicines and then I am really wishing I eat a lot of mangoes now. Mango season, of course, in India. But it may not help because I am here trying to fight maybe gastritis which I have, and or I may be putting on a lot of belly fat, or maybe somebody is gaining weight. But this said, I want to eat mangoes also. Mango is a contributory factor because mango, yes, you may not gain large weight by eating mango, but you cannot eat 3 mangoes a day also because it can reduce your metabolism. It can what we call as increase the kapha dosha in your body, and it also can therefore interfere with your digestion. And because metabolism is at stake, you are not going to achieve what you want. Okay, this is just an example. So usually people feel that if I go to an Ayurveda doctor, they're going to give me a list of don'ts. So what everybody should understand is the concept of pathya or this dietary requirements is so well integrated with Ayurveda medicines or Ayurveda prescription that people feel so, but it is actually not for the Ayurveda medicines, but it is for the person. It is for the health problem. Now, if somebody comes for knee joint pain, I might tell, okay, please don't eat something which is very heavy like pulses, the chana or chole and rajma and such things. So that is not because of Ayurveda. It's because these items or things like potato might increase vata and therefore increase the pain, because pain is finally due to an aggravation in vata, which is the controlling mechanism of the pain in the body. So it's a very, very, very important aspect when it comes to treatment, and people should be very open because finally it's for them. It's not for the science, but the depth in which they explain pathya is very important. Yes, we as doctors also will be will lean whenever they start recovering. So I ask patients many times, okay, first level 15 days, please follow this strictly. But it is also not going to be at impractical levels, because in a metro city like Bangalore, people are going to work, everybody is busy. So I cannot give them something very different which they cannot follow. So there will be a practical approach to it, but slowly you also start going a little loose on your pathya or the diet.
So, actually, this dietary recommendation definitely I should follow. Speak about yoga. So, what are the requirements to start yoga practice, ma'am?
I think right framework of mind to begin with, your belief in what you're trying to do and why you're trying to do is very important. It's just that, okay, I want to do yoga now because I've heard from so many that yoga is very beneficial. Yes, very good. So just go with openness. It is like how you hug somebody in open arms when you really like somebody. It's more like that. So you have to be very open to what you want to learn. Don't go there and try to say, oh, is this instructor teaching correct? Is her voice not okay? So you don't have to do all this. So you just try and follow somebody for some time, watch the changes in yourself rather than watching others. And I think the right framework and your readiness in terms of physical requirements is also going to play a role. Because when you start yoga, especially a group yoga class, you should know whether you are physically fit. Suppose you have a back problem and this back problem has been nagging you for a while, then you are not probably the right fit into the group, because the group is not going to watch unless the group is for back pain, in the sense yoga for back pain kind of a group. So this is also very important. So getting yourself evaluated by physicians who are trained in naturopathy yoga, or physicians who are trained in yoga also, otherwise who come from other medical backgrounds, are the best people you can actually reach out to.
Okay. As a follow-up question, what are the steps? Like for example, a person who is practicing yoga for a while, like how does this person progress? What are the requirements? How does he progress in his practice?
Right. So yoga talks about Ashtanga. So when you say the 8 different paths towards the last, which is the Samadhi. So the first two components are called Yama and Niyama. Then comes Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So the last three are something which none of us are probably even reaching in regular day-to-day scenario. But Yama and Niyama are the two foremost base components which talk about how you have to live disciplined life, what to eat, how to live, and what all you should follow in terms of even your character building. So a lot of it has been mentioned. And then they say, okay, this is the base preparation. Oh, now you're ready to do some asanas. That means to say you go into practice. It is very clear that you have to therefore cultivate yourself in terms of your habituations and mend them, and then try and go and start your practice. Asanas will help build your body, give you that physical strength and stamina, and it also helps focus. There's a very beautiful definition of asana which says Thiram Sukham Asanam. That means maintaining the stability when you do a posture, and also feel happy in that posture is very important. It's not about just completely stretching, bending. You people only concentrate on asanas when they do yoga. It's not about it. It's a lot more than that. And when your physical body is ready, then they say yes, you should do a practice like pranayama, because you have to sit in in maybe Vajrasana, or you have to sit in Padmasana when you do a pranayama practice. So if a person is not able to, or has not trained his limbs or hands, holding this itself is going to be difficult after 2 minutes. You will have to feel like dropping your hand. So everywhere there are step-by-step methodologies which have been mentioned. Like I'm talking about Patanjali Yoga Sutra, and very clear definition of how you should really upscale yourself in the yoga domain, and just not limit yourself only to asana. Then you are not cultivating what yoga or what our rishis have told in terms of your overall well-being, which yoga specifically talks about.
So again, another follow-up question here. As a common man, like, we have a common misconception saying like, yoga is different and asana is different. Can you please clarify that?
So, see, many ask, I'm doing some yogasanas. Yogasana, yes, but yoga is a science. Yoga, now, I spoke about Ashtanga yoga. So, yoga is a discipline, whereas all these are components of yoga. When you say pranayama, it's also a component. So, it is the overall picture. It is like the universe monitoring different aspects of whatever is happening. So yoga is therefore, the super factor which is there, which is the discipline in itself, and these are all components. So that's the major difference. So you should not limit yoga to understanding of asana. It's a lot more.
How about pranayama?
Similar with pranayama, it's also
so
another
yoga
component.
Pranayama is a part of yoga.
Yes. So yoga practice is all these domains: asana, pranayama, and your behavioral traits, your discipline, your lifestyle. Not only the practice, but it also wants the person to inculcate whatever is good for his or her well-being.
Good to know all these, ma'am. So moving on to the next question, probably this would be the last question, I believe. Ma'am, actually, there's another misconception here. Yoga and yoga therapy are the same, but I do believe they are both different. But can you please explain so that people can get more clear picture on how yoga therapy is different and yeah.
See, ideally, people do not know that there is something called yoga therapy. Probably we are in the field, or people who have taken the particular service with clinics like ours might probably know. Yoga and yoga therapy are otherwise very different, because yoga therapy, otherwise known as therapeutic yoga, is designed based on the Panchakosha model, And in this Panchakosha model, as I had just explained a while ago, each practice is designed based on the level of the kosha. And the similar is the problem. Now, when we say yoga therapy, say let's take anxiety for example. A person with anxiety might come just with anxiety or might come with a combination of problems. In that case, we have to check on what is important for him to get better with yoga. And that is where yoga therapy is going to play a role, because it may be a one-on-one session like we do at VHG, and we specifically evaluate the person and give this. Or it might be group, but all of them in the group should have the problem of anxiety. But yoga is not defining this specifically. Of course, yoga practices are based on the Panchakosha model itself, but it is not specifically curated for an individual. So it is just that yes, a group of 10 or 20 are there in a class, and nowadays you have both online and offline. So you have a group of practices once again, but they have a flow, the similar flow. Like, okay, it starts with a prayer and then starts with some breathing or loosening practices. Then you have relaxation, samasana, pranayama, relaxation, and maybe chanting. This is typically the way a group class would also go. And yes, it depends on the school of yoga once again. If it's a Hatha Yoga focused school, they may not have this. But since we follow traditional yoga, we definitely have this series. And the same concept is there in yoga therapy, but it is very specifically curated and personalized for the individual, because that's where people have problems. Either they go to a group class like this and get injured, or then they don't do anything. They feel, oh, yoga has given me a problem, whereas yoga has not given. You have not understood that you're not supposed to be there, or you're not a right fit there, or nobody has guided you. Yes, that's where things go wrong. So that's the major difference between the two. And say women especially, when we look at different sets of problems, some of them are maybe during their menstrual cycle, some of them are not. So this particular phase also, the practices have to be slightly changed, and this helps in keeping the well-being.
Nice to know, ma'am. Since you mentioned yoga for women, how about pregnant women, ma'am?
Pregnancy yoga is highly indicated. It's just not after a lady conceives, but yoga is definitely indicated for the couple who is also looking at conception, because it can help bring that mind-body well-being, which is essential for the right requirement of conception, also for fetal growth in progression. So during pregnancy, yoga can definitely help in reducing the stress, and because of that maybe different other fetal complications, which is maybe growth retardation or maybe mental retardation, and preventing few problems like mental retardation or different other issues which can come up in a child when he or she is grown up. And likewise, yoga can help during pregnancy to bring down aches and pains, and going forward, during labor, it actually eases out labor when it is practiced in the right way. So a lot of such benefits, and therefore overall, a lady who's doing yoga during pregnancy versus a lady who's not doing, I think they don't know, but when you experience it, you will know how exactly it's going to make a big difference to the person.
Okay. Nice, ma'am. Good to know. Thank you, ma'am. Thank you for this wonderful, valuable information you have shared. We look forward in future episodes with valuable information on other ailments or anything which our viewers want. So, thank you, ma'am.
Thank you.
So, guys, I believe today we had a valuable information session with Dr. Vasudha ma'am. So, this was VHG Talk today. We learned, we understood how yoga and Ayurveda are interconnected. Today we also learned how yoga can be practiced and how yoga therapy is used for healing. So it was definitely a wonderful session. If you like to see further episodes on any of your interested topics, definitely please post your comments below, and so that this helps us to plan our future sessions with Dr. Vasudha ma'am, or it might be any other senior doctors whom we are planning to get the information from. So thanks once again for all the viewers. Do not forget to like, subscribe, and share. Thank you.